Good afternoon, everyone. So today I'm presenting my paper on addressing the ethambutol toxicity and visual benefits of oral pentoxifylline and optic neuritis. So we know ethambutol is a first-line TB drug and it acts by inhibiting the mycobacterial cell wall synthesis and causes retinal ganglion cell apoptosis. And we appreciate temporal disc pallor due to vulnerability of papillomacular bundle. The onset is more within 3 to 5 months of use, and the risk increases with more than 15 milligram per kg of dose. The presentation may be subacute, bilateral, and painless central loss of vision, and it may be asymmetrical. In the early stages, pupil may be normal, while in advanced, we can appreciate RAPD. Initially, fundus can be normal, but later on, peripapillary hemorrhages, disc pallor, and color field defects can be seen. On perimetry, we appreciate central or centrocecal scotoma with decrease in contrast sensitivity, RNFL and retinal ganglion cell thinning in on OCT, and on VEP, P100 amplitude and latency abnormalities can be seen, and it is an early biomarker. We know pentoxifylline is a synthetic dimethylxanthine phosphodiesterase inhibitor which increases the CAMP and improves the microcirculation, thus stabilizes the endothelium and reduces the autoimmune response. It is also found to have neuroprotective action. So it is well absorbed orally, and the peak absorption is between 2 to 3 hours. The bioavailability is 20 to 30% due to its high first pass metabolism, and it is converted into active metabolites in liver and erythrocytes and mainly excreted through kidneys. It is given in a dose of 400 milligram extended release oral tablets. So the aim and objective of my study was to assess the role of oral pentoxifylline in ethambutol induced optic neuritis. It was conducted in Department of Ophthalmology at a tertiary care center between September 2022 to June 2024. It is a prospective interventional study which included patients on ATT or recent ATT with ethambutol-induced optic neuritis and willing for participation and follow-up. Those unwilling for follow-up had other optic neuropathies or recent cerebral hemorrhages were excluded. A total of 34 patients with 68 eyes were enrolled in the study, with intervention group A, which received oral pentoxifylline 16 to 18 milligram per kg body weight along with vitamin B complex for 6 months, and group B received only vitamin B complexes for 6 months. The follow-up and assessment was done for a duration of 6 months, and it was assessed using BCVA, contrast sensitivity, color vision, fundus examination, and VEP. So the results in our study, in group 1, the maximum patients were more than 50 years of age, and in group 2, it was between 31 to 40 years. Female preponderance was noted in both the groups. Improvement of vision in group 1 was 0.71 plus minus 0.21, while in group 2, it was 0.21 plus minus 0.07. On subsequent visits, there was a significant difference in improvement in vision among the groups with a p-value of 0.001. On contrast sensitivity, there is in group 1, 0.697 improvement was there, and group 2, 0.106. And on subsequent visit, the difference among the two groups was found to be statistically significant. The VEP changes is in group 1, minus 4.18, and in group 2, 4.67. And color vision changes was not found to be statistically significant among the two groups. The duration of ATT intake among the two groups was found to be statistically significant. Was not statistically significant, so the two groups were equivalent. So in our study, we included 68 eyes with ethambutol-induced neuritis, and female preponderance 62% was noted, with 10 patients more than 50 years of age. So similar studies have been done where it was found female preponderance is noted. So females have higher antioxidants in reproductive age, which declines post-menopausal age, so which may explain this finding. And the interventional group, we observed significant improvement in vision, contrast, VP latency with oral pentoxifylline, while in control groups, no such improvement was seen. So we conclude that ethambutol optic neuritis may be irreversible, especially in older patients more than 60 years of age. So it is a prospective study which objectively measures BCVA, contrast, vision, color vision, and VEP, while it is a small sample size and single center study with a short follow-up. So, but it does implicate that pentoxifylline along with vitamin B complexes may improve vision, contrast, and VEP, and early intervention definitely prevents vision loss. But there is a future scope of larger multicentric trials, longer follow-ups, and study of gender or age differences. Thank you.
So what you are saying is ethambutol toxicity is a ganglion cell problem or is optic neuritis?
So there are changes.
No. There are changes in the optic nerve, yes. But the ethambutol toxicity is primarily an optic nerve problem or it's primarily a ganglion cell problem?
Sir, it causes apoptosis of retinal ganglion cells.
Primarily a ganglion cell problem. The optic nerve manifestations are secondary to the ganglion cell loss.
Yes.
Now, what happens in ethambutol toxicity to the ganglion cells?
Sir, mitochondrial enzymes sir, involved because ethambutol is known to cause chelation of mitochondrial enzymes, complexes 1 and 4.
Okay. Why is there ganglion cell damage in ethambutol toxicity? You need to read a lot about that. I'll tell you later on. Now, in ethambutol toxicity, what happens is there is a hyperexcitability damage to the ganglion cells. The hyperexcitability damage to the ganglion cell is due to nitric oxide that is released, excessive glutamate that is released at the ganglion cell. Now, the excessive glutamate in the extracellular cells is inimical to the cell, neural cell. That's what happens. And with the ganglion cell, the specialty is that if one ganglion cell dies, the surrounding ganglion cells commit suicide. It's called ganglion cell autophagy. They all die at the same time. But ethambutol toxicity, the color vision ganglion cells are stronger. And they survive for a longer time than the ordinary vision ganglion cells. Unlike in heredomacular dystrophy, where the color vision cells get damaged early and the normal vision cells get damaged later, it's the reverse of that in ethambutol toxicity. Okay, good, well done.
Thank you, sir. Thank you.